Hi everyone, welcome to another Tip Tuesday. My name is Abieyuwa Okunseri. I'm one of the certified nurse midwives here at North Carolina Women's Care. Today we're going to be talking about postpartum blues versus postpartum depression. So it's not uncommon, actually very normal to be going through a range of emotions after delivery. However, it's important to know the difference between postpartum blues and postpartum depression. So postpartum blues is also known as baby blues. It's very common, impacts up to like 80% of women immediately postpartum. It usually sets in a few days after delivery and lasts up to about 2 weeks. Typically, the emotions experienced with this include irritability, feeling overwhelmed, being a little anxious, feeling a little tearful. These emotions are usually manageable and they tend to come and go just quickly, and they're primarily due to the hormone changes that come with delivery, and then also with the added stress of lack of sleep and things of that nature. Now, postpartum depression is a bit more serious. It impacts up to 1 in 7 women in the postpartum period, and this usually sets in a few weeks after delivery, and the feelings are a little more heavy here. With postpartum depression, it starts to impact bonding with baby, self-care, and even sometimes can come with emotions of wanting to hurt or harm yourself or your baby. Now, because of the seriousness of postpartum depression, it does typically require that you reach out to your healthcare provider for treatment and management. Now, reaching out to your healthcare provider is not a sign of weakness at all. It's actually a sign of strength, being able to get help for you and your baby. So understanding that postpartum depression can come in a few weeks after delivery, but it's not limited to just that period. It can still impact those that are even months postpartum. But like I said before, it does come with the more heavy feelings. Postpartum depression is often associated with persistent or lingering feelings of sadness, difficulty bonding with your baby, inability to take care of yourself, and also just interfering with daily life tasks. Especially if these emotions or feelings are getting worse and not better, it's particularly time to reach out to us to get some help and figure out a treatment plan. As I kind of alluded to, postpartum depression is definitely treatable. There are a wide range of treatment plans, not just medication. It can start with even just lifestyle changes, therapy, and if there is a need for medication can be a great tool as well. The treatment plan can include any combination of these options and is tailored to the individual, to what works best for that person, their lifestyle, and what they're hoping to gain out of the treatment as well. So if you're feeling any emotions or know anyone that's struggling with any postpartum depression symptoms, reach out to us and come on in and let's get you taken care of. See you guys on the next Tip Tuesday. Bye.